Dr. K.N. Manohar, Chief Diabetologist and Chairman of KRSSDI. As the saying goes, health is wealth, regardless of age, but over time, most of us get busy with our day-to-day tasks and forget to pay attention to our health. While it may not seem like a big concern at the moment, with enough time, our bodies develop chronic conditions based on certain lifestyle patterns. At Credo Health, we aim to address and help people predict, prevent, delay, and manage these conditions with the help of clinically validated, evidence-based, and AI-powered programs and necessary lifestyle modification. You might be wondering what I'm talking about and how we aim to do this. So without further ado, let's look at how. What I'm talking.
We take you on a journey of discovery and help you decode the secrets of your well-being. You are unique. What you do, what you eat, and how you live determines how your body responds. The human body is a self-enabling intelligence system, a goldmine of vital information that holds the secret to managing all your chronic conditions. We at Credo Health capture this vital data through continuous remote monitoring sensors and help you decode your metabolism and address various biomarkers at a granular level. Our precision care plans are tailor-made to suit your unique conditions. Credo Health's range of programs includes our holistic intervention helps you inculcate healthy life-changing habits and optimize your nutrition and medication. The outcome would be a significant improvement in the quality of life, tangible delay in the progression of your chronic condition, fewer complications, and lesser need for hospitalization. Credo Health helps you keep track of your milestones and health records and acts as a one-stop solution for all of your medical needs. Your personal health coach and a whole team of specialists ensure that you accelerate your progress to your desired state of health seamlessly. The AI-powered care pathway decodes your chronic conditions, enabling us to predict, prevent, delay, and reverse them with a fine balance of precision technology and human touch. We help you ride the bicycle of your health once again with renewed energy and confidence, making you the hero of your own well-crafted wellness story. Enroll with us to upgrade yourself to the new decoded you.
Hi, I'm Sonia Sudhir, a homemaker from Chennai. I've been diabetic for the past 5 years. I came to know about the Credo Health through a friend of mine and enrolled in their one-year program in last September 2021. Then they introduced me to their health coaches who used to regularly be in contact with me regarding my diets and my medicines. They introduced to me a very good device called CGM, which is continuous glucose monitoring machine, which takes your data of your glucose 24 hours. Right after 6 months of the program itself, I could see a major significant changes in my diabetic life. HbA1c, which was 9.2, reduced to 7.6. Estimated average glucose reduced from 217 to 171, and also my fasting sugar and the average sugar reduced very significantly, and I could feel the changes in my body too, which helped me in better growth. But once I started this program, and I could feel the change. My body was light, I was more fit, so I started joining the badminton classes, and my physical activity increased to 40 minutes per day. Before joining the Credo Health app, I had severe problems of ankle swelling, joint pains, polyphagia, which is excessive hunger, and polyuria, which is excessive urination, bloating and tingling of my in my feet also. All these symptoms have reduced significantly, and even the intensities have come down. After joining the Credo Health program, I have become more energetic and more lively. I feel as a new person. Thank you, Credo, for joining me in this journey and making me a more lively person. Thank you so much.
Hi, I am Sunil. I am a software engineer working in Bangalore. So, I am a chronic diabetic patient. A little background about me: I was diagnosed with diabetes at the age of 24. I was on insulin since then. It's almost 14 years now. So my life was very frustrating. I never led a normal life. I never enjoyed a festival. I never enjoyed a party. So one of my friends suggested about this program from Credo Health, where he was a member. I approached them. I called them, and they suggested me, and a lot of lifestyle changes have happened. So there is a concept called coach with them, where they interact with me in and out. There is a dietitian who is assigned to me particularly. So I started feeling hopeful again. I'm very healthy now. My sugar count is under the control now, in the range. I'm able to work out more. I was very dull, very sleepy all the time before this this particular program happened to me. So there is a total insight of what food I should be taking, and when I see a random junk food, it rings my mind that this has these many calories and I should not be doing that. So that is one thing. And there is an amazing device that they gave me. It's called CGM, continuous glucose monitoring. That actually really helped me. So as long as it was on my body, I was very conscious in doing things. So there is a very psychological effect on that. So whenever CGM is there on me, it actually tuned my mind and what I should do, what I should not do. It was a very good experience for me. 3-4 weeks with the CGM patch. So I have a problem, I call up my coach, and she immediately, probably in 1-2 hours, she gets me back with a suggestion. So that's a very good thing. So yeah, I'm really happy about it.
Well, wasn't that interesting? Now that I have your attention, first I would like to welcome Dr. S. Chandrakumar, the founder and executive chairman of Kaveri Group of Hospitals. He founded the Kaveri Hospital Group with his friend from a humble 30-bed facility to make quality healthcare of his foundation. He is a past chairman of the CIA Southern Region Healthcare Panel and the chairman CIA State Healthcare Panel. Over to you, Doctor.
Thank you, Sarvana. So good afternoon, everyone. I really appreciate your time amidst of hectic activities in Karnataka and particularly Bangalore. Thank you very much. And we have our leadership team in Credo. We have Dinesh, who is the Director of Technology. We have Dr. Raj, who is the Medical Director. And we have Dr. Chakravarti, who is the Head of the Product. And we have Arpita, who is the Head of Nutrition. And co-founder Lalita Krishnamurthy, and our medical advisor, Dr. Manohar, with you. And it's a proud moment for us to be here with you on this day. For a practicing clinicians over the last 2 decades and also healthcare management professional, what brought us to start the digital precision care, which is Credo? Just at the beginning of a COVID, couple of years back, I had undergone 2 major incidents. One was a very close non-medical friend, in early 40s, around 42, 43, suddenly developed a major cardiac event, and he had to undergo coronary artery bypass. The whole family went in turmoil, and this particular friend could not speak for 30 days. He underwent a major depression. He couldn't speak, though the parameters are all right. On looking back, he had diabetes, which he ignored. The family also did not know that. That's the first incident. Surprisingly, just a couple of months later, my doctor friend, who was also in early 40, had to undergo an emergency transplant. His creatinine was high, and nobody knew that he had a chronic kidney disease. But one finding was, the last 2 decades, 20 years, he had been a hypertensive, he has been on medication, but there was no record that he has been checking regularly and is under control. See, these two completely threw me out of the routine. And these incidences, people having a cardiac event or people having kidney disease, quite normal, happens for a doctor. We at Kaveri operate around 150, 200 surgeries. But when it affects our near and dear one, it really makes us feel bad that we should do something there. So at that point of time, I thought doctors normally treat sick patients when they come to the hospital, when they come to the disease. Why can't we be more proactive, try to address their chronic conditions far more efficiently, trying to be with them and try to make an impact in their life. I think that's how the story of Credo born. Me being a clinician, I had to take the help of the technologists. And my friend, Mr. Leo, who's an unavoidable recent traveling, who's a technologist, last 20 years I know him. Lalita, who's in US and India, travels between this. Then we, in a group together, that's how the Credo was born. From the infection, like tuberculosis or Hansen's disease, very infectious disease, we have moved to a non-communicable disease, like diabetes, the cardiac disease, the respiratory disease, and cancer. They form nearly 60% of the death anytime. If you have 100 people having a problem and death, 60% of them because of the diseases. That's the number one factor. Number two, you see all the statistics, I think most of you are aware, 77 million of diabetes, 90 million of pre-diabetes. 70 to 75% of the diabetic patients in the first 10 to 12 years develop a cardiac problem. And 44% of the people who are diagnosed to have a chronic kidney disease first time, all of them are diabetic. That's a very scary scenario. Then we thought we should just look at and go for this treatment, how we can do this. So if you have to make a difference in the community, you can't do a conventional treatment. What's happening in the conventional treatment, the patient goes to the doctor and the doctor gives a prescription, spend 10 minutes, 15 minutes, maximum there is a counselor. But after that, when they go home, a lot of doubts, whether it is this food I can take or whether it's a medication is right. And those doubts in the current treatment, we have a big challenge in addressing them. They are not continuously engaged. But what method we are trying to propose? The entire treatment scenario is changing in the West. Probably in the West, 3-4 years old. In India, the last 1.5 2 years it is happening. The patient is in the middle of the treatment. Everything revolves around the patient. It's called circle of care. Whether it is your technology, whether it is your member engagement, or it is about your nutrition support, or data analytics, you have the health record in their mobile application. I think the entire healthcare from a conventional, it is changing to a paradigm shift to a digital one. I think the next few years we see, probably we are a little early, 1 or 2 years ahead, but I think the entire healthcare system will change towards the digital precision care. And what we have done so far, so we have not only addressed the diabetes, but associated complications. We thought it is important. We have diabetes, we have important cardiac rehabilitation, wellness, also chronic disease. In addition, we do weight management, there's obesity and also PCOS, thyroid. And we have done a pilot study of 1,800 patients. Out of that, we have taken around 900 patients, the usual care, regular care, and the 900 patients in the Credo treatment where we engaged. And we have published those results that Mano is going to present in American Diabetic Association the next couple of months. We have also presented in the International Diabetic Federation on the outcomes, on the reduction in what are the various parameters and how it is measurable. It's not just only patient feels, it's all documented by the outcomes. So this talks about the conventional treatment, which is usual care, and what is the Credo precision care. The first one is so we have reduced we have taken an equal set of people, around 800 people. In the usual care, 43 people got admitted, and whereas in the Credo care, only 15% got admitted. The reduction in the admission is 65%. And the admitted days, also there's reduction to 60%, from 143 days to 57 days. Whereas in the overall cost, for the usual care is around 53 lakhs, and whereas in the Credo it is 11 lakhs, which is a 78% reduction. The next one is from the usual care, the A1C was 8.9, whereas in the Credo care it is 7.3. There's a 1.6% reduction. This study is now happening over a period of last 12 months, but this data is around 6 to 9 months data. It means around those number of patients have completely been data scanned over a period of 6 to 9 months. The next one is rehospitalization. In chronic kidney disease, in a cardiac patient, number of people gets readmitted within a period of 1 year, whereas in the usual care, 7.8% got admitted again, whereas in a Credo care, only 3.8%. It means 50% reduction in the readmission. In a cardiac patient, after the cardiac surgery, how is their quality of life? You grade the quality of life into 1 to 5. 5 is the most well-being, 1 is the least one. More than 80% of these people had a quality of life within the 90 days between 4 and 5, which is good and very good. So that's the impact we are able to bring with the Credo digital precision technology over the last 1 year. So what we want to do before we come into the market, we wanted to get convinced and demonstrate scientifically that we are able to produce a significant impact on the patient outcomes. Once we have demonstrated, that's where Manohari can also talk about how his patients have experienced that. And we are delighted to be in front of you and formally launch the program to the public. So far we have been doing with a couple of doctors and friends and relatives, and also we took some help of Kaveri Hospital. We have done this and we are very, very happy to be associated with you. Thank you very much. Now I invite Dr. Alita, who is a computer scientist who lives between India and US, and she has been, she's a doctorate in artificial intelligence, and she has done a PhD in neurosymbolic computation, and she has worked in IBM corporation over the last nearly 2 decades and various positions. Now she's the co-founder. She'll be demonstrating what exactly happens on the field to the member. Please.
Kumar said, this is an exciting moment for us because this is when we're really coming out and talking about what the mic and what we are about and what the Credo platform can actually do for a chronic condition patient. Today I'm actually going to attempt the live demo and take you through the app and show you about, you saw the video that played about the company. You saw the testimonials from two of our member patients. And you heard Dr. Chandra Kumar talk about the genesis of the company. And what I'm going to demonstrate is how does all of that come alive from a Credo technology platform perspective. So what happens is we're putting the patient at the center of this entire healthcare ecosystem by empowering them with knowledge, data, and artificial intelligence. So in the case of our app, for the sake of the demo, we're going to pretend that I'm actually a cardiac patient with a comorbid condition of having low glucose. And to me, this is extremely helpful because, you know, with those conditions, there are 2 things that are actually happening here that needs to be monitored. One is my cardiac, all my cardiac vitals. The second thing is to keep an eye on my low glucose levels to make sure that it doesn't drop off. Now, I was recommended and referred to the Credo program by my doctor because I needed the support. So what happens when I first started with the Credo program is there were a lot of discussions between me, my health coach, and my doctor to arrive at something that's very specific, a key differentiator for the Credo technology platform, which is a precision care plan. Now, the precision care plan is personalized, it's flexible, it's iterative. For a lot of us who are busy and are trying to figure out how to manage a chronic condition with technology, with the support of physicians, and make sure that we can still continue to live our life the way that we've been doing so. So in our case, when I was referred to the Credo platform to get help, the first thing that was done was a precision care plan was defined. No. Hey, come on. Okay, thank you. So once I got the precision care plan, now I will take you to where I start my day and how I use the app in order to manage and live my life while I continue to figure out how I manage my chronic condition that I have. This is where I start my day. This is the home screen of the Credo app. And as you can see, as a patient that is a cardiac patient with low glucose levels, what happens is that this is where I start, where it shows you my key vitals that are important for a cardiac patient. It shows my heart rate, it shows my activity, it shows blood pressure, it shows SpO2, and my weight. So every morning I'm able to find out where I stack and how things are looking for me as I get started for the day. If you click on my medication log, it actually lists the medications that I'm supposed to take over the course of the day. And there are reminders that are also available that tell me when I should take these medications. If I go into my meal log, you will see that it already has predetermined meals that have been brought up for me through the rest of the day. So I don't have to worry about what am I eating, am I getting the right nutrition in order to manage my condition. Now, if I scroll towards the bottom, it also gives me all of the appointments for the day that I have with my health coach or the doctor. Now, this is super important because if at all there is a point where I have to reach my health coach because I'm not sure if a certain thing is happening or I'm not feeling too well, then there is a way for me to reach them. And I can also reach my doctor, my physician, directly through this appointment interface and this integration that we have with the platform. In fact, I just noticed that I have a call with my physician, my doctor, right now. So if you don't mind, I'm going to join for just about 10 seconds. So this is how I would do a teleconsult with my physician, real time, and I can even FaceTime with my doctor to let them know how I'm doing and how things are happening. Now, after that, you will see on the top here, it actually has a sync body sensor. Now, given I told you that I actually have low glucose comorbid condition, it's one thing to maintain and watch my cardiac vitals. It's also important for me to know how I'm doing in terms of my glucose levels over the course of the day. So we actually have a platform level integration with CGM, which is the continuous glucose monitoring, which one of our members explained in the testimonial. And I'm actually wearing a CGM patch right now. Took a while. So when I do this, it actually gives me a live reading, a real-time reading of where I am with my glucose levels. There is a go to trends chart here where I go, and it's going to pull up a graph and show you the last few readings. Now, for somebody who is not a medical professional, for someone who's an IT professional, like I said, who's busy, what this tells me is it actually color codes the last few readings, and it tells me in the gray zone that my glucose level is actually dropping, and it's showing that I'm in a low glucose thing. Now, this is super important information for me, real time, because it actually tells me where I stand in terms of my overall glucose levels and what I should do and what I can't. There is an info button here. Now, in order to we actually have a recommendation engine and a personalized engine where it looks at these readings and tells me what I need to do, because a lot of us may not even know. So having the data is one thing. The other thing is for it to give you actionable insights. So the recommendation engine comes back and says, in red, the alert that my glucose levels are actually dropping. You guys saw that was like around the 50s, 60s range. So it's actually something that is alert to me and tells me that I should start having a snack or eat something which is high calorie value in order to bump up my glucose levels. The other feature I'm excited about showing you today is the trends place, where we actually have the platform integration done with GFit and with Fitbit. So what this allows you to do is, depending upon whatever wearable device you're wearing, it could be a 1,000 rupee watch that you're wearing to take care of your activity and your vitals, or it could be any watch or any wearable device you have. We actually have those integrated through Google Fit and Fitbit in order to provide device level integration and real-time data that you can sync with the app. So all of the vitals and information that's important will show up in the Credo app right there in one page. And this becomes a single pane of glass because you can go through and look at all the key vitals that's being captured and understand where you stand in the sense of having a chronic condition that you're trying to manage. The other thing that is important for you to note here is that all of this data is actually visible to your physician, your health coach, and to yourself at any point in time with your consent. So this data is also being looked at by them. And if there is a reason for them to intervene, they can actually intervene directly with that phone call, the teleconsult that I showed you earlier about. The other thing I want to show you here is something called the digital health passport. Now, as a lot of us are traveling, we are at different locations at different points in time and have busy schedules. What the digital health profile allows you to do is actually carry your health profile with you as you travel. Like, for example, we're in Bangalore today. I come from Chennai. So depending upon the hospital I go to, you can actually take your digital health profile and share that with your friends, family, caregivers, your support groups, and anybody that you wish to share your digital profile with. So let's say I get hospitalized in Bangalore, I can actually share this with the physicians and the doctors who may or may not have the entire background of what my medical profile is. The good thing here is it has actually in-depth information about past hospitalizations and past surgeries that I've had. And it also has very good information about pretty much everything that I've had in terms of a medication perspective, both before and past. This is super important information that any doctor, any hospital would want to know, when you check in and you're a brand new patient showing up at the door. The other thing I want to share with you is that all of the data that we have on the platform from a technology perspective is encrypted and your data is secure. And unless the member actually consents to provide that information and share that, we actually do not share that with anyone. In fact, we actually have delete my account, which you can see towards the second last, where if at any point in time, if a member says, look, I don't really want my data to be on your platform or anything for whatever reason, they can go and take care of this themselves and then basically leave and exit the system. The other thing I want to show you about is, some people wear wearable devices, and sometimes you may not be wearing a smartwatch or anything to take care. So that's not a big deal. If you're not a smartwatch user or a wearable device user, you can absolutely use, any of the body composition meters. You can use the Omron blood pressure monitor, any of those devices, because we do have platform level integration built into that. And the other thing that I wanted to show you, there's a lot of stuff I want to show you, but in the interest of time, I just want to touch just on, overall on the nutrition. There is, there is diet that's equally important in terms, I showed you the meal log. What this actually tells you is the total amount of calories that I'm consuming with all those meals that were listed. And it helps me track, how well I'm doing for the rest of the day. So if I overate a breakfast, then I can adjust my calories and my carbs so that I can better take care of my chronic condition. So those are some of the key differentiators and features that we have built on the Credo technology platform, which, like I said earlier, surrounds and goes around the fact that this is all centered around the patient, their care, and centered around the healthcare ecosystem. But what we do is support them through knowledge, making them aware of the data, making them aware that there's an artificial intelligence engine that's behind, which is providing recommendations at the right time, to the right person, in the right way. So with that, I'm going to pivot to showing you two demos which show you the power of the artificial intelligence engine that actually powers a lot of this, the results. The first one, I'm going to unplug here. So this one is a really cool one. I know that everybody is busy. We want to log our meals. We want to stay as clear as possible to the diet and nutrition recommendations that we're given. But however, busy lifestyle takes over, and sometimes all we want to do is we don't have the time to log the meal. What we want to do is actually be able to take a quick picture of the food that you're eating and be able to just upload it. And you want the engine to be intelligent enough to be able to identify not just the item, but also the calorific value. What's the carb look like? What's the fat? What's the protein? What's the fiber, right? So that you can compute, was this a healthy meal that I've had or not? So in this case, we're going to do this live. Again, taking a risk. But the work before I could tell you what it is, so it's pretty fast. But what it actually does, it actually goes and does a image recognition, very similar to biometrics, right? At the airport when you guys do your fingerprinting, similar technique, right? It's called visual recognition signal processing. And what it does is Dr. Mazumdar was helping me with. And then it tells you the energy level, the carb, and everything breakdown. So this is much easier for us instead of actually having to go in and log, I ate 2 idlis, I hate this chutney.
Dr. Lalita? Yeah. I'll just also tell them what we are trying to do in a one word, because sometimes if it is okay with you. See, what we are trying to, Namaskara ellarigu, ನಾನು Dr. Manohar ಅಂತ. ಇಲ್ಲಿ ಏನು ತೋರಿಸ್ತಾ what we are trying to show is day to day what happens with the patients, whether it is sleep, from waking up to heart rate to pulse to exercise to diet, gets captured and tells us what is it good, how it is going to affect your sugar or pressure or your cholesterol pattern, and what is the difference, how we can make a difference to it. For example, madam rightly showed it that idli ಎಷ್ಟು ಕ್ಯಾಲರಿ ಕೊಡ್ತಾ ಇದೆ, 72 ಕ್ಯಾಲರೀಸ್ ಕೊಡ್ತಾ ಇದೆ ಅಂತ ಹೇಳ್ತಾ ಇದೆ. ಸೊ ನಾವು ಎಷ್ಟು ಊಟ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಅದರಿಂದ ಎಷ್ಟು ಶುಗರ್ಗೆ ಅಥವಾ ಬದಲಾವಣೆಗಳು ಆಗುತ್ತೆ ಅಂತಲೂ ಹೇಳುತ್ತೆ. ದೆನ್ ಇಟ್ ಇಸ್ ಸಜೆಸ್ಟಿಂಗ್ ಆಲ್ಟರ್ನೇಟಿವ್ ಫುಡ್. ಇಟ್ಸ್ ಐಮ್ ಟು ಕ್ಲೋಸ್ ಟು ಅದ್ರ ಬದಲು ಬೇರೆ ಏನು ತೊಗೋಬೋದು ಅಂತ ಕೂಡ ಸಜೆಷನ್ ಮಾಡುತ್ತೆ. So, and it is in local languages also, and it is to the patient. Someone may not eat idli, someone may, from North Indian may eat parota for the breakfast. So, like I'm just giving an example, for every meal pattern, what it has and what it means to their sugar, pressure and cholesterol, in the long run how it can harm you, if possible what are the alternatives, ಅದ್ರ ಬದಲು ನೀವೇನು ತಗೋಬೋದು ಅಂತ ಕೂಡ ತೋರಿಸುತ್ತದೆ. ಸೊ ಇಟ್ ಈಸ್ ಲೈಕ್ ಈಗ ಡಿಜಿ ಯಾತ್ರಾ ಮಾಡ್ತಾ ಇದಾರಲ್ಲ, ಈಗೆಲ್ಲ ಒಂದು ಫೋನ್ ಹಿಡ್ಕೊಂಡ್ರೆ ದೇ ವಿಲ್ ಗೆಟ್ ಇನ್ ಟು ದ ಏರ್ಪೋರ್ಟ್ ಅಂಡ್ ಗೆಟ್ ಔಟ್ ಆಫ್ ದ ಏರ್ಪೋರ್ಟ್ ವಿತೌಟ್ ಮಚ್. ಸಿಮಿಲರ್ಲಿ ದ ಫೋನ್ ವಿಲ್ ಬಿಕಮ್ ಎ ಡಿಜಿ ಹೆಲ್ತ್ yatra for us. Everything, whatever little things we do which matters to us medically gets captured. I just wanted to reinforce it. That's all.
Thank you for doing that. That was very helpful. Thank you. I think he made the point very well. So this is our food image recognition engine that we've built in the back using machine learning that allows you to actually see your overall nutritional value so you can better calibrate and again manage your life easier, right? That's the whole point. When you have a chronic condition, it's stressful enough. The last thing you need is actually to have to go multiple loggings. So the more easier we make it for the patient, the more chances are that they will actually be able to get better sooner. The other demo that I have, I don't know how much time I've run out, but I'll keep going. It's lab OCR. So let's say that I'm in, I travel from Chennai, I'm in Bangalore, I go into our hospital here, and the doctor says, hey, you know what, listen, Lalita, you got to get blood work done, or I'm going to give you a new prescription. Say I come down sick. Now, I want to get that prescription and my lab report quickly to my doctor, right, my treating doctor. So what do? I mean, I could just sit and scan all day and figure out a way to get it out there, or I could go into my app and quickly upload it, and I uploaded the document here, and I'm going to say predict. So what's happening in the background, this might again take about 15 seconds or so for the engine to process. There's two things that's happening. There's an ETL data extraction, so that is basically taking all the data in your prescription or your lab report, parsing it, breaking it down, taking the data and putting it in the system. And the second thing it does is making sure that only, if there is an anomaly or there is some deviation from what the data is showing, it's actually going to have to, going to have to make any manual intervention required. So what it does here is basically taken my lab report that I just uploaded and showed you, and it's telling you what is the test that was done and then the different values that were pulled from the report. And it puts all this into our secure encrypted database in the back, so it's immediately available for access to our coach, to my health coach, and to my doctor. So those are two of the key ones that surround our artificial intelligence technology platform that we wanted to demonstrate today. I really thank you for listening, and with that, I'm going to pass it back to Dr. Chandrakumar. Thank you.
Thank you, Dr. Lalita. So your entire demo was a true technologist. And in between, Dr. Manohar was saying that whether they're really able to catch up those things, that's where he intervened. And Dr. K.N. Manohar is an eminent physician, diabetologist, has been associated with Manipal Hospital for the last 2 decades. And he's a man who practices what he preaches. Many times doctors are poor. I mean, coaches cannot be a great player, but I think he preaches and also practices. And he is an examiner for MRCP in UK. He's also examiner for DNB medicine. And he's extremely active in the health education, various media, be it TV or a radio or the newspapers. And he has been a great source of strength for us on validating the most of our clinical findings. Over to you, Dr. Manohar, please.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ, ಧನ್ಯವಾದ ಬಂದಿದ್ದಕ್ಕೆ. ಪೊಲಿಟಿಕಲ್ ಹೀಟ್ ಆಚೆ ತುಂಬ ಇದೆ, ಟೆಂಪ್ರೇಚರ್ ಕೂಡ ಜಾಸ್ತಿ ಇದೆ, ಅದರಲ್ಲೂ ಬಂದು ನೀವು ಮೆಡಿಕಲಿ ಯು ಆರ್ ಲುಕಿಂಗ್ ಅಟ್ ಆಸ್ ಆ್ಯಂಡ್ ದಟ್ ಕಾಲ್ಸ್ ಫಾರ್ ಎ ಬಿಗ್ ಥ್ಯಾಂಕ್ ಯು ಫ್ರಮ್ ಆಲ್ ಆಫ್ ಅವರ್ ಕ್ರೆಡೋ ಟೀಮ್. Secondly, to summarize in 1-2 sentences what they said, Dr. Chandrakumar had a great vision to see that where technology and medical field can come together to benefit the patients. And Dr. Lalita, Indian American, the best of both worlds, artificial intelligence, digital health, which is the way forward. We don't know how intelligent we are, but if we don't marry ourselves to the artificial intelligence and digitization, we'll be left behind. So whether we all like it or not, That is the way forward. So we have one of the best persons. So she showed live 3 things she said. One is continuously glucose monitoring. Immediately it will know what is your sugar, then what you are eating, how much you are exercise, immediately what it impacts. Third is she got a doctor's consultation, and that also comes in, and any clarification. So this is, she showed it live. Like, this is how I want you people to understand what happens to the patients when they are on this program. So that is what we are trying to show you. So for me it is the medical side. I thought my slides are loaded, it's all right. So simplest thing what I can think of, what Dr. CK has visualized is lifestyle disease needs lifestyle intervention as the first therapy. It's the most important thing. Second thing is, when we sit with the patient, we need to be honest here. It's like, unlike in the UK or US, they have scheduled appointments, and if they see 15 patients or more, 20 patients, it's like the busiest day of their life. Here, each doctor on an average sees at least 100 patients or more many times. So is that 1 to 5 minutes consultation, is it enough to close the bracket and make the patient understand and get the best benefit of diet, exercise, drugs, complications, education or not? So this is what they discussed with me. So usually again, as doctors, we feel, okay, our work is taken away by someone else. That is also wrong. When you are associated, see, we can't work it. That's why we, like for example, you're all reporters, let's say. If you say you only have to go edit it, print it and give it to the public also, it's not possible. So we have to first have trust in this system. She showed how it is encrypted and the data won't leak to others also. Thirdly, we can't do everything. Now we have dietitians, but in our Indian mentality, most of the times when we see patients, dietitian idare ಮಾತಾಡಿಸಿ ಅದಕ್ಕೆ ಕಾಸ್ಟು ಇಲ್ಲ ಅಂತ ಅಂದರೆ ಇಲ್ಲ ನೀವೇ ಹೇಳ್ಬಿಡಿ ಸರ್, ಇಲ್ಲ ಅಥವಾ ಡಯಟ್ ಗೊತ್ತು ಸರ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಬಟ್ ಎಷ್ಟೊಂದು ಡಯಟ್ ನನಗೂ ಗೊತ್ತಿಲ್ಲ. ಸೊ even 10 minutes extra if you spend time, then they realize. So as Dr. CK was telling, I have the highest number of patients in this program. Why I have? Possibly because I believe in this concept. First thing is to make sure I have the trust and belief in what they are doing. Then only I can wholeheartedly work towards it. Secondly, as he told, I am into lifestyle and interventions. After a long learning, my mom used to scold me like, you tell everyone diet and exercise, you never do it. So last 5-6 years especially, I'm into diet, exercise, education, nutrition, whatever. So I know that. Thirdly, in any book you open, first and foremost, like let's say I'm the chairman of Karnataka Diabetes. So even treatment wise, the best mode of treatment for diabetes is diet and exercise. It reduces HbA1c by 1.5. Most of the other drugs can give 0.7 to 1.2 apart from insulin. So the most effective tool is the most neglected tool, and this neglected tool is the cause of diabetes, obesity and all those pandemics. We know the COVID pandemic, it came and I hope it is on the way out. But we don't know, we are in a silent pandemic of obesity, diabetes, heart disease, kidney disease. In India we get all these things 10 years ahead of the Western world. In America they get diabetes at 45, 50 or 55. We get it at 30, 35 or even lesser on an average. We have seen much younger also. So why so-called westernization, and we have forgotten our roots? And we have to be told now what to eat, how much to eat, how much to exercise, how much to sleep, how much to work, how much not to work. So this big part of work, which ideally everyone should know, or a doctor or a nurse or a paramedic should tell, is taken care by this our Credo application. So I hope that's what is the crux of the thing. So technology can't be left behind, and at every step it will send you reminders, it will tell you, okay, you did it, you can do some additional exercise, and in the local language. Kannada bardiroru, Kannada bit bere bardiroru, Kannadallu ide, Tamilallu ide, Hindi ide, every language it is there. So it becomes more friendly, and the health coaches, I had good experiences with them. See, for example, even in Karnataka or anywhere in India, every 30-40 kilometers you travel, the food pattern changes totally. So Dr. Chandrakumar has dosa in the night, we all have it in the morning. isn't it? Chennai. So that's the difference. So individualization. ಇಲ್ಲದೆ ಹೋದರೆ ಒಂದು ಚಾರ್ಟ್ ಕೊಡ್ತಾ ಇದ್ವಿ ನಾವು, ಡಯಟಿಷಿಯನ್ಸ್ ಒಂದು ಚಾರ್ಟ್ ಕೊಟ್ಬಿಡ್ತಾ ಇದ್ವಿ, ಎಲ್ಲರಿಗೂ ಒಂದೇ ಚಾರ್ಟು. ಸೊ 3 ಪರೋಟ ನಾವು ಪರೋಟ ನೋಡೇ ಇಲ್ಲ ನಾವು ಎಷ್ಟೊಂದು ಜನ. ರಾಗಿ ಮುದ್ದೆ ಇಲ್ವಲ್ಲ, ರಾಗಿ ಮುದ್ದೆ ಏನು ಕ್ಯಾಲರಿ ವ್ಯಾಲ್ಯೂ. ಸೊ ಈ ಬೇಸಿಕ್ ಕಾನ್ಸೆಪ್ಟ್ಸ್ನ ಅದು ತೋರಿಸುತ್ತೆ. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇಡ್ಲಿ ತೋರಿಸಿದ್ರು, ಇದನ್ನು ತೊಗೊಂಡೋಗಿ ನಾರ್ತ್ ಇಂಡಿಯಾದಲ್ಲೆಲ್ಲ ಅವ್ರು ಯಾವಾಗ ಒಂದ್ಸರಿ ತಿಂತಾ ಇರ್ತಾರೆ. ಇಟ್ ವಿಲ್ ನಾಟ್ ಹೆಲ್ಪ್ ಇಟ್. ಸೊ ಇಟ್ ಈಸ್ ಇಂಡಿವಿಜುವಲೈಸ್ಡ್. ಸೊ ಕೇರ್ ಈಸ್ ನಾಟ್ ಜಸ್ಟ್ ಸೇಮ್ ಫಾರ್ ಎವ್ರಿ ಒನ್. ನಿಮಗೂ ಇವ್ರಿಗೂ ತುಂಬ ವ್ಯತ್ಯಾಸ ಇರುತ್ತೆ. ನಿಮ್ಮ ವೆಯ್ಟ್ ಬೇರೆ, ನಿಮ್ಮ ಆ್ಯಕ್ಟಿವಿಟಿ ಬೇರೆ, ನೀವು ಊಟ ತಿಂದು ಮಾಡೋದು ಬೇರೆ, ನಿಮ್ಮ ಶುಗರ್ ವ್ಯಾಲ್ಯೂಸ್ ಬೇರೆ, ನಿಮ್ಮ ಬಿ ಪಿ ವ್ಯಾಲ್ಯೂಸ್ ಬೇರೆ. ಸೊ ಇಟ್ ಈಸ್ ಇಂಡಿವಿಜುವಲೈಸ್ಡ್ ಆ್ಯಂಡ್ ಇಟ್ ವಿಲ್ ಸಪೋರ್ಟ್. ಈ ಥರ ತುಂಬ ಜಾಸ್ತಿನೇ ಹೋಗ್ತಾ ಇದೆ, ಜಾಸ್ತಿ ಕಡಿಮೆನೇ ಆಗ್ತಾ ಇದೆ, ಇಮಿಡಿಯೇಟ್ಲಿ ಹೋಗಿ ಡಾಕ್ಟರ್ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ಅಂತ ಹೇಳಿದ್ದಾರೆ. ಸೊ ಈ ನಿಟ್ಟಿನಲ್ಲಿ ನಾನು ಆಲ್ಮೋಸ್ಟ್ ಒಂದು 100 ಜನ ಪೇಷಂಟ್ಸ್ನ ಈ ಪ್ರೋಗ್ರಾಮಲ್ಲಿ ಹಾಕಿದ್ದೇನೆ. ಸೊ ವಾಟ್ ಈಸ್ ದ ಥಿಂಗ್ ಈಸ್ ದ A1C ರಿಡಕ್ಷನ್ ಇಸ್ 1.8. ನಾನು ಹೇಳಿದ್ನಲ್ಲ, ಯೂಶಲಿ ಡಯಟ್ ಎಕ್ಸಸೈಸ್ ಗಿವ್ಸ್ 1 to 1.5. ಅದರ್ ಮೆಡಿಸಿನ್ಸ್ ಆರ್ ಮಚ್ ಲೆಸ್ಸರ್. The people who reduce the A1C is by 1.8 units. And more, up to 80% of the patients, we needed a dosage reduction in the treatment. So insulin dose, tablet dose, because healthy lifestyle changes mardaga, lifestyle disease, lifestyle changes is the answer. Thirdly, there are other companies, beautifully, I was looking carefully at the slides what Dr. CK presented. Some people talk about reversal anta, it's a huge marketing thing. ರೆಮಿಷನ್ ಅಂತ ಹೇಳ್ಬೋದು. ರಿವರ್ಸಲ್ ಅಂದರೆ ಇದಕ್ಕೆ ಬರೋದೇ ಇಲ್ಲ, ಡಯಾಬಿಟಿಸ್ ಬಂದರೆ ಹೊಟ್ಟೆ ಹೋಯ್ತು ಅಂತ, ಆ ಥರ ಆಗೋ ಚಾನ್ಸಸ್ ಬಹಳ ಕಡಿಮೆ ಅಥವಾ ಆಗೋದಿಲ್ಲ. ರೆಮಿಷನ್ ಅಂದರೆ ತುಂಬ ಕಂಟ್ರೋಲಿಗೆ ಬರ್ಬೋದು. ಕೆಲವರಿಗೆ ಮಾತ್ರೆನೂ ತೆಗೆದಿದ್ದೇವೆ. ರೀಸೆಂಟ್ಲಿ 500 ಶುಗರ್ ಇರೋರು 3 months ಬ್ಯಾಕ್, ಈಗ ಐ ಹ್ಯಾಡ್ ಸ್ಟಾಪ್ ದ ಟ್ಯಾಬ್ಲೆಟ್. ಬಟ್ ಕೇರ್ಫುಲಿ ಅಬ್ಸರ್ವ್ ಹಿಮ್, ಡೋಂಟ್ ಟೆಲ್ ಯುವರ್ ಡಯಾಬಿಟಿಸ್ ಇಸ್ ಗಾನ್ ಆ್ಯಂಡ್ ಫರ್ಗೆಟ್ ಅಬೌಟ್ ಇಟ್. ಈಸ್ ಇನ್ ರೆಮಿಷನ್ ಅಂದರೆ ರಿಸ್ಕ್, ಈಗ ಶುಗರ್ ಜಾಸ್ತಿ ಇಲ್ಲ, ಕಂಟ್ರೋಲಲ್ಲಿದೆ, ಬಟ್ ಯು ಕೀಪ್ ಎನ್ ಐ ಆನ್ ಇಟ್. Don't forget about it. And lifestyle changes, who should do? That is the other important question. Is this program only for a person who is diseased and who is having diabetes, hypertension, heart disease? No, lifestyle changes is for everyone. Today I am diagnosed to have diabetes, suddenly I should not become like, oh, today onwards I should not eat sweets. It's not that. Every human being on the earth, from a kid, nowadays in our country we said, you spare the kids, let them eat what they want. Childhood obesity has become a big problem. So from womb to tomb, everyone should have lifestyle changes and healthy lifestyle adoption. So that is the message we are driving. I am very happy to announce here that American Diabetes Association conference is happening in June, and our paper has been accepted. We are given almost 100 patients, and this is incredible. Results are catching the eyes of the foreigners. It is done even in the foreign countries also, but to the cost and to the level, I think this is a very important ingredient. I always tell when I speak, all these things should become a school curriculum and a office target. ನಿಮ್ಮ ಆಫೀಸ್ಗಳಲ್ಲಿ ಎಲ್ಲರಿಗೂ ಒಂದು ಟಾರ್ಗೆಟ್ ಕೊಟ್ಟಿರ್ತಾರೆ, ಇಷ್ಟು ಮಾಡಬೇಕು, ಅದು ಮಾಡಬೇಕು, ಇದು ಮಾಡಬೇಕು. ಆ ಥರ ದೇ ಶುಡ್ ಆಲ್ಸೋ ಗಿವ್ ಎ ಹೆಲ್ತ್ ಟಾರ್ಗೆಟ್. ಇನ್ ಒನ್ ಆಫ್ ದ ಕಂಪನೀಸ್ ವಿತ್ ಐ ಆಮ್ ಅಸೋಸಿಯೇಟೆಡ್, ಐ ಟೋಲ್ಡ್ ದಮ್, ಯು ಗಿವ್ ದಮ್ ದ ಹೆಲ್ತ್ ಟಾರ್ಗೆಟ್ಸ್. ಐ ಆಮ್ 10 kgs more, at least by this year end, give 3 kgs less, at least 4 kgs less. Or BP should be under control. So then that awareness is most important. Then only all these health issues will come down. Diabetes, hypertension is all lifestyle diseases. We promote, we don't educate it to that level. There are a lot of, I was seeing my son's book, 9th standard, so many things what I read in first year MBBS is there in that. But I always tell them we are planning to start a school program on that. Actually, that give targets. This is the normal BP, this is the normal sugar, this is the normal cholesterol, this is the normal sleep time, and what is yours, what is your father's, mother's, brothers, grandparents. That will educate everyone a lot. So till then, I think this is a great insight, great concept driven by wonderful technology, and I urge people to try it and to see it. She herself was very, I also wore it. ಟು ಸಿ. ಈಗ ಮುದ್ದೆ ತಿಂದರೂ ಒಂದೊಂದ್ಸರಿ ಶುಗರ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಮುದ್ದೆ ಒಳ್ಳೆಯದು ಅಂತ ಹೇಳ್ಬೋದು, ಬಟ್ ಎಷ್ಟು ಸೈಜ್ ಮುದ್ದೆ ತಿಂದಿದ್ದೀರಾ ಅದ್ರ ಮೇಲೆ ಡಿಪೆಂಡ್ ಆಗುತ್ತೆ. ಸೊ ಲಾಟ್ ಆಫ್ ಕಾನ್ಸೆಪ್ಟ್ಸ್ ಆರ್ ದೇರ್ ಆ್ಯಂಡ್ ಇಂಡಿವಿಜುವಲೈಸೇಷನ್. ನಿಮಗೆ ಹೇಗೆ ಒಂದು ಆಹಾರ ಅಥವಾ ವ್ಯಾಯಾಮ ಎಫೆಕ್ಟ್ ಮಾಡುತ್ತೆ, ಆ ಥರ ನಂಗೆ ಎಫೆಕ್ಟ್ ಮಾಡದೇ ಇರ್ಬೋದು. ಸೊ ದಟ್ ಈಸ್ ದ 2 important things what we like to highlight here in our product. ಒಬ್ಬ ಪೇಷಂಟ್ಗೆ BP ಶುಗರ್ ಇತ್ತು, ಯೋಚನೆ ಮಾಡಲಿಲ್ಲ ಅದ್ರ ಬಗ್ಗೆ, ಸಡನ್ನಾಗಿ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಸ್ಟ್ರೋಕ್ ಆಯಿತು, ಅವಾಗ ಎಷ್ಟು ಕಾಸ್ಟ್ ಆಗುತ್ತೆ, ಎಷ್ಟು, ಆಮೇಲೆ 100 ಜನ ಸತ್ರು, 500 ಜನ ಸತ್ರು ಅಂದರೆ ಅದು ಒಂದು ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಆಗುತ್ತೆ. ನಮ್ಮ ಹತ್ತಿರದವ್ರಿಗೆ ಏನಾದ್ರು ತೊಂದರೆ ಆದರೆ ಅದು ಲೈಫ್ ಲಾಂಗ್ ಸಫರಿಂಗ್ ಆಗುತ್ತೆ. ಇಟ್ ಇಸ್ ನಾಟ್ ಜಸ್ಟ್ ಎ ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್. ದಟ್ಸ್ ವಾಟ್ ವಿ ಯೂಸ್ ಟು ಟೆಲ್ ಇಟ್ ಇನ್ ಕೋವಿಡ್ ಆಲ್ಸೋ. ಸೊ ಅದಲ್ಲದೆ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್. ಈಗ ಯಾರೋ ಒಬ್ಬ ಒಂದು 10 kg 8 kg ಕಡಿಮೆ ಆಗಿ ದ ವೇ ಹಿ ಲುಕ್ಸ್ ಅಟ್ ಲೈಫ್ ಈಸ್ ಡಿಫ್ರೆಂಟ್. ಸೊ ನಾಟ್ ಓನ್ಲಿ ಪ್ಯಾರಾಮೀಟರ್ಸ್, ಬಿ ಪಿ ಕಡಿಮೆ ಆಯ್ತು, ಶುಗರ್ ಕಡಿಮೆ ಆಯಿತು, ಅದು ಒಂದು ಕಡೆ. ಇನ್ನೊಂದು ನಿಮ್ಮ ಕ್ವಾಲಿಟಿ, ಜೀವನ ಶೈಲಿನೇ ಬದಲಾವಣೆ ಆದಾಗ, ಆ್ಯಂಡ್ ವಿ ಇನ್ಸ್ಪೈರ್ ಪೀಪಲ್. ನಾನು ಎಕ್ಸಸೈಸ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ನನ್ನ ಪೇಷಂಟ್ಸ್ ನನ್ನ ಕ್ಲಿನಿಕ್ ಮನೇಲೇ ಇರೋವಾಗ ಎಲ್ಲ ನೋಡ್ತಾ ಇರ್ತಾರೆ, ಓ ನೀವು ಮಾಡ್ತಾ ಇರ್ತೀರಲ್ಲ ಅಂತ. ಸೊ ಇಟ್ ಇನ್ಸ್ಪೈರ್ಸ್ ಪೀಪಲ್. ಸೊ ದಿಸ್ ಇಸ್ ವಾಟ್, ಆ್ಯಂಡ್ ಫಿಟ್ ಇಂಡಿಯಾ ಮೂವ್ಮೆಂಟ್, ದಟ್ಸ್ ವಾಟ್ ಇಟ್ ಈಸ್, ಫಿಟ್ ಇಂಡಿಯಾ ಮೂವ್ಮೆಂಟ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಸೊ ನಾವು ನೋಡಿರೋ ಒಂದು ಪೇಪರಲ್ಲಿ ಕ್ವಾಲಿಟಿ ಜೊತೆಗೆ ಕಾಸ್ಟ್ ಕೂಡ ಕಡಿಮೆ ಆಗಿದೆ ಅಂತ ಇದೆ. ಐ ಆಮ್ ಸಾರಿ, ಇಟ್ ವಾಸ್ ನಾಟ್ ಅಪ್ಲೋಡ್. ಐ ಥಾಟ್ ಇಟ್ ಇಸ್ ಅಪ್ಲೋಡ್. ಇಟ್ಸ್ ಫೈನ್, ದಟ್ಸ್ ಓಕೆ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಏನಾದರೂ ಪ್ರಶ್ನೆಗಳಿದ್ರೆ ವಿ ಆರ್ ರೆಡಿ ಟು ಆನ್ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you, Dr. Manohar. Yeah. So CGM is for 14 days. Okay. And every 15 minutes it gives the data. Per day it gives 96 times. So that data is collated. I mean, what we are working as we move forward, that Lalita showed about, and we will also be now saying what the next week your sugar will be there. That is under pilot. Now, after studying the 7 to 10 days, the glucose details, with a nutritional pattern and lifestyle, we are working on how to predict the next week. Without testing the blood sugar, we want to predict that. That's in the process. Our Director of Technology is working on it.
Is your CGM works with all, compatible with all the thing, your application?
Yeah, whichever NFC compatible mobiles, it will work. Please.
Normally designed for mass usage. But in your case, I want to ask you whether it is tailor-made, individual, or again it is going to work in the interest of the mass?
So the way that we've designed the platform is for scalability. So we are actually using best-in-class open source customized software. We're actually deployed on DevOps, Azure DevOps. So we thought some of this stuff right at the beginning, that this has to support both an individual, and it also has to be designed for mobile, because that's really where digital is going tonight, right, and today. And it also needs to serve for a population health. So in case you're trying to go that scale, where this becomes an essential tool and a platform that everybody can use in order to not just, like Dr. Manohar said rightly, it's not just about, I have a chronic condition, so I need to run to Credo. This needs to be something that anybody should be able to use, even if you want to just stay healthy, just be well in general, and change your lifestyle modification around diet and nutrition. So yes, it's been designed for the masses as well.
Sir, my question is for Dr.
Sorry,
Manohar.
just one. Conventional treatment, a chronic condition patient or a member has to physically go and meet the doctor. Maybe some 10% are using a teleconsultation, telemedicine. But the power of technology is how we can take to a large masses across the globe. The first one is improving the accessibility. And the second one is how the quality of the care can be improved. Third is how do we engage and give a far more superior experience. I think that's what we want to use with the power of technology. The same Dr. Manohar, if he's in Bangalore, somebody who's in Mumbai also can go for a second consultation. I think clearly the foundation is laid, and we want to go much larger scale across the country, beyond the country. Thank you.
Okay. So that has to be taken into applications, because the moment what happens, it is a tech driven. Your app is totally tech driven, and it loses the interface of the doctor and the patient. In fact, what happens, the moment when he gets the signal, because I will tell you my own example. I am also a diabetic. Why I want to give my own example is I am convinced with my own conditions and my own parameters. So I am around, whenever you test my diabetic, it is 180 to 200. Whenever, since 20 years I am there. Of course, my co-brother is a doctor. He told me your GTT is very strong. Your glucose tolerance test itself is like that. Even with these parameters, I am eating regular sugar and not so sincere about my exercises and all, but still I am feeling better. So in such conditions, how you analyze the individual? Because the moment when he eats, it will show you a signal that no, you have to call the doctor. But in reality, it doesn't happen. So how that you are going to bridge this in your app?
I think there is a bit of a confusion between glucose tolerance test and what you told. Actually, glucose tolerance is the sugar drinking, and then you check the sugars. That nowadays we use it only mainly in gestational pregnancy diabetes.
and theoretically, yeah, to confirm diabetes, but none of us use it in routine practice. What you're trying to tell me, I understand, is some of you are having higher sugars, but you're feeling fine. Well, to answer the very difficult question, when we make any guidelines or anything, it is based on a population based. Yeah, it's yeah. For an individual, some people, we see this also, like they don't take care as much as we want them to take care, but they are fine. Some people, they take care, but they're still having problems. So there, it could be due to multiple other factors rather than just the sugar itself. His genetics, family histories, and the complications associated, other comorbidities will answer that question. So, but however, 100% all of the medical professionals will agree that you should control your sugar to that range, BP to this range, and cholesterol to that range. So whatever set values are there. Someone may not be doing it, but they seem to be all right, but we can't encourage that to say that it's okay not to take care. So individualization, as the app is said, the app is general app, but when you feed your documents and data, it will make, and you are from this place and this is your eating pattern, it will give you individualized, focused advice to you. And it will tell, and the alert values can be set. Alert value can be loose or tight. For example, in your age, sir, I would like to have the sugar to be much higher than usual lower range. For someone who is very young and fit and he doesn't have any other health issues, we want it to be lower. So that also can be set by your own doctor. And again, I would like to re-emphasize that we are not taking away the doctor's role here. You said the doctor touch is not there. Doctor touch is there with the help of the artificial intelligence. You can't go and keep telling your doctor, I ate this and the sugar is this much and this has come down. Continuously, nobody can answer. As it is, we are so busy that we don't answer our own home calls, and these calls will not be able to answer. So this sugar is gone high or low will be sensed to the tech team, and they will say an alert value, a dietitian or a health coach, or if required, a doctor also will come into the picture based on the seriousness or severity of the situation.
I'll just, one more point I want to add. I think all the chronic conditions needs self-management of the diseases. The CGM, the moment we are able to see what is the report, it gives a modified behavior. Like you take idli, the sugar, what it shots. Then you say, can I take some vegetable before the idli? Modify. Same thing we do it. It changes the pattern how we do it. And also, whether you take fruits before, you take vegetable before, clearly you can see the difference, because once I see the data, my ability to accept those things changes. For example, if I'm having a watch, we have a group where we do 10,000 steps a day. If I do 8,000 steps by end of the day, I start walking for 15 minutes or so. The moment I see my sugar level reaches, then I think, okay, I need to avoid this. All of us, we were testing that. Sometimes when you take a sugar, it shoots up to 200. Next time, we try to avoid the quantity of the sugar. So ultimately, for all chronic conditions, it is the sustainable and a modifiable behavior, it makes a big impact. I think that is where the data given by this technology bring those changes. Those modified behaviors brings a better outcome. I think that's the whole theory about this. Thank you.
Diabetes alone, because I'm sitting here. Out of the 100 patients, 40 to 50 patients of mine are people who are heavy weight is more and they want to lose weight. There are another, see again, should I tell everyone, like for example, all of you, should I tell every one of you to do this? Again, we should make some proper choices of the patients and then tell them. Like if you try and tell everyone, it is not going to happen it that way. So we should create some interest and awareness towards that, how important this is. And if you look at the average consultations of a diabetic for hypertensive, it is yearly once or maybe less. So is it that is good enough is the first question. So putting this into the place will tell you, and I always tell, if you get into this program, it's not only you, the whole family gets benefited. The dietary patterns of everyone's will change. My dad was a diabetic, so my house diet pattern had changed then. Fortunately, I'm not yet a diabetic, but then it really helped us to know the importance of it. So that mass awareness is created by enrolling one person also. They closely see how different it could be and then how changes it can be made.
And the glucometer, there's a 5 to 10% difference. Same thing between a CGM is a continuous glucose monitoring. It is the blood sugar sample in the interstitial.
Chennai and other parts of Tamil Nadu, and you're approaching now Bangalore?
Yeah, so we have done the pilot program so far. We have not gone for a commercial launch. Today is the first day. Officially, we have opened for the public. We want to start that in Bangalore now for all the diseases. Hypertension, cardiac program, kidney disease, diabetes, or weight management. We will launch.